the underlying issue in healthcare today is how do we improve access? How do we continue to improve safety and quality? But we've got to tackle this issue of affordability. And in order to do that, we can't do it alone. And so I think the work that I've done, not just at Atlantic, but throughout my career in creating these partnerships, sometimes with folks that people kind of didn't think needed to be in the equation, has been very important and has changed dramatically how we might approach issues. So I think that, as we are working as an association, and we have been doing this and we need to continue to do it more, I think we need to seek opportunities to hear the voices of others, but also participate with them in direct and indirect ways. Because, we've got some important issues facing us, and it's going to take, it's going to take a village to solve them. I always ask 3 simple questions whenever faced with a complex decision, and they're in this order. The first is, how will this impact our patients? How will this impact our staff? And how will this impact our finances? The thing that drives me, though, every day is I have just a curiosity about what we do and the care that we provide and how we provide it. So it's not unusual to see me in an OR or to be talking to physicians or other staff about how we do what we do. And I think that curiosity about what we do and the deep respect that I have for folks who care directly for patients has really guided me throughout my career. One of the things that was important to me when I moved from Hopkins to Atlantic is to get to know the people at Atlantic. And, we have 16,000 employees, and it's fairly spread out. So we had an organized process over the first month where I would get out every day in many areas just to meet people. The other thing that was quite funny about it, which I didn't realize was happening, is as they were, videoing that event and those activities, they had somebody going in front of me with a sheet of paper with my last name on it. And the question was, how do you pronounce his name? Because I unfortunately don't have the easiest name in the world to pronounce. And they made a video of that, and it is an absolute riot. The other thing I do on an ongoing basis is I've had now my 62nd breakfast or lunch with 20 or so staff at a time. And we bring them from all over the organization and just have an opportunity to have a conversation. And so I think I'm probably up to 7,000 people now. One of the things that has been most concerning to me over the last 6 months as we've gone through this debate within Congress is making sure that the voice of our patients is heard. And I'm really proud of the work that the AHA has done and that our member organizations have done about putting a face on our patients so that we never forget that everything we do really relates back to how does it affect our patients and how can we support our communities. And I think that is a purpose that everybody can get behind.